If you look around today, it really, really feels like the pandemic is a thing of the past, doesn't it? I mean, you see packed concerts, busy airports, people gathering without a second thought. It honestly feels like we've snapped right back to 2019. But is that feeling, is that perception, actually matched by what's really happening in late 2025? Well, let's dive into the data and see if this thing is truly in our rearview mirror. To really frame this whole question, I want to start with a pretty powerful analogy. Just think about smoking back in, say, the 1950s. It was everywhere. It was cool, it was fashionable, completely normal. And it took decades, literally decades, for the overwhelming science about lung cancer to actually shift how people thought and behaved. There was this huge lag between the scientific reality and the social reality. And that, right there, brings us to the big question of this whole explainer. Are we in a similar spot right now? Have our social norms, our very real desire to just move on and get back to normal, has that outpaced the scientific evidence about the long-term risks of this virus? Okay, so first, let's dig into that feeling of normalcy. Because look, on the surface, it really does seem like it's all over. This is where you see this massive disconnect. The perception is we're back to normal. Crowded concerts, packed stores, it feels just like it used to. But the reality is starkly different. According to CDC data from November 2025, the virus is still actively spreading and growing in 20 states, with hospitalizations hitting very high levels in parts of the country. So while it feels like 2019, the viral landscape just isn't. So the question is, if the virus is still a big factor, why do so many of us feel like it's over? Let's break down the psychology behind this huge shift in perception. Well, there are a few key things driving this. First, the official public health emergencies were declared over back in 2023. That sent a really powerful signal to everybody. The media also shifted away from daily case counts, and, let's be honest, after years of alerts and restrictions, a collective COVID fatigue set in. People were, and still are, just plain tired of it. And this shift has also been shaped by some really deep political divisions. A Pew survey from February of 2025 really highlights this. It shows that while 60% of Democrats saw masking in crowds as important, only 26% of Republicans felt the same way. It's just a crystal clear sign of how much our public health choices have gotten tangled up with our politics. And when that's the backdrop, the dominant narrative on social media and elsewhere starts to mock caution as paranoia. It creates this intense social pressure that actively discourages people from taking protective measures, and it just reinforces this idea that the threat is totally gone. Okay, so that's the perception. Now let's pivot and talk about the scientific reality. What's being called the quiet, often invisible epidemic of long-term consequences. So let's be super clear about what we're talking about here. Long COVID, or PASC as it's known clinically, isn't just about feeling tired for a couple of weeks. No, it's a complex, multi-system condition with persistent, often debilitating symptoms. We're talking chronic fatigue, brain fog, even organ damage that can last for months or years, and in some cases, it might be permanent. And I really want to stress, this is not a rare outcome. The data we have over and over again shows that somewhere between 10 and 30% of all COVID infections, even the really mild ones, can lead to long COVID. Just think about that for a second. With hundreds of millions of infections in the US alone, we are talking about a staggering number of people. Now this is the crucial point that so often gets missed. There's really no such thing as a harmless infection. The data is showing us that even a quote-unquote mild case can significantly increase your long-term risk for really serious conditions, things like stroke, new-onset diabetes, and autoimmune disorders. And what's truly alarming is that this damage is cumulative. Every single time you get reinfected, your odds of developing long COVID can go up. And when you zoom out and look at the population as a whole, you can see this quiet rise in chronic illness. By 2023, 61% of young adults had at least one chronic condition. That's a jump of 5 to 10% that's being attributed directly to the pandemic. And we're seeing similar increases across every age group. What's happening, in essence, is the virus is prematurely aging the entire population's health profile. This is a slow-motion public health crisis unfolding right in front of us. And of course, behind all this data are real human beings. This comment from November 2025 really just nails the frustrating, hidden reality of this illness. It says, they do not understand that their COVID infection may be mild, but underneath there's hell breaking loose. It just speaks volumes about that invisible internal battle so many people are fighting. This all raises a huge question, right? If the risks are this significant, why aren't they more widely known? And this brings us to what we can call the Great Awareness Gap. The problem becomes really clear when you look at public awareness. According to 2025 survey data, about a third of Americans have never even heard of long COVID. Wild, right? Another chunk knows the term but just dismisses the risks as being rare or mild. And then you have this large group that kind of understands the risk, but because of that fatigue or social pressure, they just aren't taking action. And when you put it all together, the staggering bottom line is this. Somewhere between 85 and 95% of adults in the US are not adequately protecting themselves from the real long-term risks of the virus. This isn't just a small blind spot. It's a near universal vulnerability. And each one of these awareness gaps creates a specific problem. I mean, if you've never heard of it, why would you take precautions? It makes no sense. If you think it's just being tired for a bit, you don't really grasp the high stakes of developing a new chronic illness. And if you're just exhausted by the whole thing, the desire for normalcy just wins out. When you add them up, these gaps are fueling ongoing transmission and disability. So what can we actually do? The goal here isn't to live in fear. It's to recalibrate our understanding of risk using simple tools that can have a really big impact. This is all about harm reduction. And the good news is we have proven practical strategies. High-quality masks like N95s can cut transmission dramatically in crowded indoor spaces. Improving indoor ventilation, just opening a window, helps everyone. Updated vaccines are still highly effective at preventing severe disease. And testing when you have symptoms helps protect the people around you. These aren't lockdowns. They're just smart, simple adjustments. Which brings us right back to where we started with that smoking analogy. Right now, the idea of smoking on an airplane seems completely unthinkable, but it used to be totally normal. So, given the quiet, accumulating, long-term risks of this virus, the final question I want to leave you with is this. A few decades from now, are we going to look back at today's unmasked crowds with that same sense of disbelief? It's something to think about.